Good afternoon and welcome to the ESU's Innovation Center, where today we are officially announcing the creation of the Pennsylvania Tick Research Lab at East Stroudsburg University through the efforts of Representative Rosemary Brown and funding through the Pennsylvania Department of Health and Human Services. This announcement marks a game-changing moment for our university and especially for our Northeast Wildlife DNA Lab, a lab that continues to be at the forefront of research and innovation and the future home of our new Pennsylvania Tick Research Lab. The Northeast Wildlife DNA Lab was founded in 2005 and focuses on vector-borne disease research, specifically Lyme disease and other tick-borne diseases. It is equipped to process thousands of tick tests each year and provides tick testing for Lyme disease and 16 additional tick-borne pathogens. This lab is dedicated to providing research, surveillance data, and education on ticks and tick-borne diseases to our campus community and Commonwealth. Today's announcement marks yet another milestone for the DNA Lab and for ESU. In April 2012, Lyme-Aid, a tick testing kit for people and pets, was developed in the lab in this building. It was the first commercialization of a student-faculty research project in the history of ESU and the first for the Pennsylvania state system of higher education. In 2014, the lab was presented with the opportunity to rebrand and repackage Lyme-Aid under the Cutter brand name. On July 20th, 2017, the official announcement of the Cutter Lyme disease tick test, the first nationally recognized brand name product developed at ESU, was announced in this room. Today we celebrate the development of the Pennsylvania Tick Research Lab, another first for ESU made possible through the support of Representative Rosemary Brown. Her relentless efforts and advocacy for Lyme disease testing and education to the Pennsylvania Department of Health and Human Services has resulted in a $500,000 award to ESU. This funding will support the development of the lab, creation of a data analytic website, and provide free tick testing to Pennsylvania residents. It's important to know that all of the tick testing will be completed by our well-trained students and staff in the ESU Northwest Wildlife DNA Lab located here in the Innovation Center. This lab is managed by ESU graduate Nicole Chinichi and provides Lyme disease test results with a 99.9% accuracy. Nicole, will you stand up so everyone knows who you are? As president of East Stroudsburg University, I couldn't be more proud of the efforts led by the DNA Lab and the partnership with Representative Brown, as together we address the need for research, education, and awareness of tick-borne diseases, a public health crisis across the Commonwealth. It is now my pleasure to introduce Representative Rosemary Brown.
Good afternoon, and thank you, President Welsh. It's such a pleasure to be here. This is a fantastic, wonderful announcement for not only East Stroudsburg University, but really the residents of Pennsylvania and for the district. And the important piece that I think we need to remember when we're looking at the funds and this award here at East Stroudsburg University is that Pennsylvania ranks #1 in reported cases of Lyme disease since 2011. And that's, it's a tremendous, we don't want to be honored with that number, that's for sure. But we are #1, and that shows the necessity of these funds and what we're trying to accomplish here. I began working with East Stroudsburg University and Nicole Chinichi because of this number and because of the prevalence in Pennsylvania and how important that I thought it was for the health of residents. And my concerns, as well as the value of what I saw what East Stroudsburg University in the laboratory were doing, was what really brought us together and what really helped focus the efforts on this initiative. Pennsylvania needs to have even more information on exactly what's in these ticks, where these ticks are, and how we can utilize this information, how it's transmitted, and how it may affect people differently. I've had way too many people in my district and people that I've run into that have been suffering from debilitating Lyme disease. And really, the efforts that we're trying to do is get ahead of that so that people don't find this disease at late stages or when they could have found it earlier. And so when you look at Lyme disease and tick-borne illnesses, a lot of times some of the blood tests and some of the labs that you would get sometimes are negative, or they're missed for many, many years, or there's no signs or symptoms for years. And that really is the key here, because if you're lucky enough to find the tick, and I'm sure Nicole will talk about this in a moment, but ticks are sometimes the size of a poppy seed. So you might have a tick on you and the tick may fall off and you'll never know that you've had a tick on you if you've been exposed or you have a risk factor. However, if you're lucky enough to find the tick and get the tick and hold the tick and then have the tick tested, you can see from the lab results of the tick testing what's inside that tick, or the possibility that you might have been exposed to something that could then cause a disease that could be debilitating. So it's the most accurate way of being proactive and making sure that we protect people's health. So really the goal here is to educate the population on the prevention and the resources, as well as offer the knowledge and the research and the science that will help us in Pennsylvania and hopefully across the country. There really is a tremendous amount that we still need to understand about Lyme disease and tick-borne illnesses. I do have a package of bills that I wanted to mention as we're here today that also support the further efforts that I'm doing with Lyme disease and tick-borne illnesses. And one of those bills is to mandate a 2-hour continuing education program for physicians that would actually present them with the most up-to-date medical information and research that we have. And I'm hoping some of this research from the lab will be included in that if this legislation was to go through, offering doctors every bit of information that they can utilize to help get ahead of the disease and maybe help their patients early on. And especially until this disease, subsides a little bit in the numbers. The other piece is also removing ticks from students while they're in school, saving the tick, and then again offering them information on how they may have the tick tested, again to further prevent a child from being exposed to Lyme or tick-borne illness and then it's showing up later on in life. We've also passed a resolution, of course, honoring East Stroudsburg University and the laboratory and now our tick research lab for all that they have done for Pennsylvania. They also train many of the Department of Health speakers who also go out throughout the state and speak on Lyme disease and tick-borne illnesses, and they are very helpful for other surrounding states as well. And lastly, we also are encouraging the federal government to allocate some of their $21 million towards Pennsylvania because of our status as being #1 in reported cases. So we have a lot of efforts that we're pushing to really focus on this issue and make sure that we take care of our residents in Pennsylvania. It is a public health crisis, as Dr. Welsh said, and it is something that we need to know more about. And that's why we are so thankful for what they do here at East Stroudsburg University and why I was so honored to help secure and initiate with them the funds to help for free tick testing and to further our research efforts. And I definitely did not want to see a parent come in with a tick that they've pulled off their child and have them walk away and not get it tested because of a cost issue. I wanted to make sure that they would say, okay, I have this tick, let's get it tested, We have at least 4 that we'll be testing for with this grant funds as far as the pathogens, and that parent can feel that they've done their best to make sure that they've protected their child's health. So I am very pleased and honored to present this check for $500,000 from the Commonwealth of Pennsylvania Department of Health and Human Services to East Stroudsburg University's Tick Research Laboratory. So we will do the official in a moment, but I do want to give Nicole Chinichi a chance to come up here because she has become a dear friend because of the work that I have seen her do and the passion that we both share with our research and trying to really do the best that we can for the residents of Pennsylvania. Nicole.
Thank you, Representative Rosemary Brown. So the Northeast Wildlife DNA Lab, we are now going to be the Pennsylvania Tick Research Lab, thanks to the efforts done by Representative Rosemary Brown. And it's an initiative that we're extremely excited about. Pennsylvania is the leading state for Lyme disease. A lot of other tick-borne diseases are not reported, so we could potentially be #1 there as well. And we are so much higher in our cases than even our surrounding states, New Jersey and New York, who are actually #2 and 3. And furthermore, the diagnostics when it comes to humans, it's lacking right now. It's very difficult because when you know anything about bacteria, the Lyme bacteria is extremely smart, so it really hides out from our immune system, so it makes human testing very difficult. But when you have the tick, you could take the tick and you can analyze what the tick is carrying and determine your risk and exposure to these diseases. And that's exactly what we're going to be doing with the state funding. We're providing the residents now with free testing for 4 different diseases. It will be Lyme disease, Powassan virus, and then 2 others depending on your species of tick. We will be having all of this data is going to be live on our website. We'll be showing hotspots. We'll be showing where tick distribution is located. We'll be looking at metrics to determine at what time of the year different ticks we're being exposed to, where the ticks are being attached on a person. So we're measuring a lot of different things so that we can give data not only back to the community, but to the departments of health, to local urgent cares and physicians out there for further awareness. And we're going to be developing a lot of educational material as well that we can pass around the Commonwealth. And it will also benefit states that are close and surrounding to us as well, because this information is not just common to the Commonwealth, but also to other states as well. So we're very excited, and we thank everyone who helped us to get to this part. And I will, I guess, open it up to questions now.
I will do the presentation. Do we have any questions from any of the press? There'll probably be some individually after, I'm assuming. Okay. And on that point, we're going to do the official check presentation. This is a big check.